All right, it is 1 o'clock. It is 1:33, and we will start the meeting of the Maine Recovery Council. I welcome all of the council members that are here with us today, plus at least one of our new appointees is here with us. Congratulations, and we'll start the meeting as we always do with going around and introducing ourselves, and particularly with Darren being a new member, sharing who we are. And then we'll start with public comment, but I'm going to start with Paul.
Paul Vinsel, I'm appointed by the Attorney General. I'm a addiction medicine physician working with Spur Inc. and the Family Medicine Residency at Central Maine Medical Center, all of Lewiston.
And the chair of our governance.
Whatever, sure, governance.
Daryl.
Hi, my name is Daryl Stewart, new member. I'm the acting state budget officer for the state of Maine. And when the governor asked me if I'd be interested in doing this, I jumped at the opportunity. So thanks for everything you guys have done so far. Look forward to the opportunity.
Well, thank you. Welcome.
Betsy Fitzgerald, representing the litigating subdivisions.
And the secretary.
And the secretary.
My name is Pat Kimball. I have been appointed by the Attorney General. I'm a recovery advocate and the current chair for the Maine Recovery Council.
Cassidy Toole, I am the executive director of Maine Recovery Council, former council member.
I am Elizabeth Porter, and I am the coordinator for the Maine Recovery Council.
My name is Grayson Havens. I use they, them pronouns. I'm with the Attorney General's office.
My name is Brendan O'Neill. I'm an assistant attorney general in the Attorney General's office. And I provide legal counsel to the Recovery Council.
Maggie McLaughlin, I'm representing litigating subdivision, City of Portland, and member.
Great. Welcome, Daryl. That's Parks. I am the policy director for Maine Recovery Action Project, and I was appointed by the Attorney General as a person with lived experience.
Thank you, Joe.
Hi, everyone. I'm Joe Everett, the CEO at the Opportunity Alliance here in South Portland, a member of the council, and I chair the Program and Grants Committee meeting. And welcome to our new members.
Thank you. Well, Reagan, you want to introduce yourself?
Sure, thank you. Hi, everyone. My name is Reagan La Rochelle. I was appointed by the Speaker of the House to serve and hold the harm reduction seat on the council. And I look forward to meeting you all in person.
Thank you. And Melissa.
Hi, all. My name is Melissa Hackett. I use she, her pronouns. I was appointed by the Senate President, and I'm the coordinator for the Maine Child Welfare Action Network. With apologies, I'm going to go off camera shortly because I need to drive between places, but glad to be virtually here with you all.
All right, thank you. All right, I think that is all that council members that are here. I'll remind people to speak up. And when you, because we have people listening in online, when you raise your hand, please say who you are so people online know. For those who are online, please limit what you put in the chat because again, it's not, public can't see that. And in full disclosure of our meetings, we want to make sure that the public he's and sees all that we are doing here for the council. And for the newer members, I will remind you that if you are online, in order to vote, we have to see you visually. If you go offline while we're talking, that's fine. But if there's a vote, we have to see you visually in order to vote. All right. With that said, unless you have any questions about that, I will move on to public comment. I'm gonna remind people that for it's 15 minutes. We do have it set aside for public comment. We ask people as much as possible to sign in advance. We do have a few rules and guidelines. As one is that we're asking people to keep it to 3 minutes. We're asking that this is not a time to request for money, but to give us information about who you are and what you're seeing in the community. We ask that your language be respectful of the council and for the general public. And if it's not, the person facilitating the public meeting will stop you at that point because we want to make sure that we recognize people and are respectful. I think that is all, and I want to remind council members, although you can ask clarifying questions, this is time for the public to give comment, so we don't want to take their time away by talking, having us take up the conversation. We have that to do during our meeting time. And maybe before we start the public meeting, Liz, do you want to quickly introduce yourself?
Sure, sorry.
Take a breath.
Liz Blackwell Moore, my pronouns are she, her, and I am the director for Cumberland County Public Health.
Thank you. And we did have one person sign up to be able to speak at our public meeting today, and that is Willie from Needle Point Sanctuary from Bangor. And so I'm going to turn it over at this point to Willie. Welcome, Willie.
Good afternoon, everybody. Thank you so much for having me, and thank you for all the work that you're doing to support people in many communities that are impacted by substance use disorder. I represent Needle Point Sanctuary. We are a syringe service and harm reduction program in Bangor, Maine. Historically, that has its roots in the grassroots as a volunteer-led project founded by current and former drug users as a response to the overdose epidemic. I wanted to speak today about the importance of supporting peer-led programs in both the pillars of harm reduction, treatment, and recovery. As we know, some of the most effective interventions for substance use disorder are those that were pioneered and led by people with lived experience of substance use disorder. And I think it's important that the council consider ways to continue increasing support for such programs, whether it's peer-led recovery centers, harm reduction programs, syringe service programs, all the more so in light of recent federal funding cuts that are impacting things such as harm reduction. Like I'm about to do a training in a couple of hours where I've been told not to use the word harm reduction, right? Because SAMHSA is now discontinuing funding for that. So we know that these are the programs that are working most closely with those who were impacted by the actions of the Sackler family and the policies that impacted people in the aftermath that led to around 8 million people going from prescription opioids to street level supplies of heroin. These programs are effective, and these programs are financially a lot more sustainable than other programs because typically they rely on a huge wellspring of grassroots support, volunteers at all levels, people in recovery, people currently experiencing substance use disorder, have an immense desire to give back to the communities that they are a part of, but oftentimes can lack direction in how to do so. So I think supporting programs like these is an effective use of this funding and really is a way to stand up for the principles behind this, right? Speaking to the importance of lived experience and taking advantage of that expertise. Thank you so much for your time.
Willie, thank you very much for pointing that out. And thank you for the awareness. I was not aware that we were not allowed to use the word harm reduction anymore in regards to federal funding. That's a little disheartening. But thank you for sharing that information, and I think it's important that we are aware of changes that are happening federally and how that will affect the people here in the state of Maine and how what that means for this council and the requests that will come before us. So thank you for that. Anyone have any comments or questions in regards to Willie being here with us today? Thank you, and really thank you and your organization for the work that you do. I selfishly live in the Bangor area, so I know what important work you do for that area of our state, which has been greatly affected by the HIV outbreak and how important harm reduction is and the work that your organization does to save lives. So thank you for that. We will be talking about Sanctuary. Sanctuary also is a receiving agency from this organization. And I don't know whether, well, we'll wait for the meeting to order to talk about that. What's happening with that. And I thank you for joining us. So,
Thank you, Willis.
Liz?
I know we have other folks here who wanted to do public comment too, who didn't sign up.
And it's okay if we need to submit it, that's okay. I understand.
We can. Great. So Willie, thank you very much for doing that. Any other comment? If not, we do ask people to sign up in advance to do that, but that's only because we're trying to keep it within the 15 minutes and have time for our meeting. But we certainly have not gone over on our 15 minutes. So we'd love for you to introduce yourself and share with us why you're here.
Thank you, thank you. This is we're here out of pure gratitude. This is just a real, as following what Willie said, and Willie, thanks for your comments. This is a very difficult time for a lot of us who are working with marginalized populations, and that is a very large net now, even more, large, it's all of, it's people in our families, it's people across the board. And this, we felt heard in our proposal, and we're two of the we're representing a trio of the recipients from the most recent Maine Recovery Council Award, Maine Association for Americans, Yvette.
Yeah, I'm Yvette Tunevas, I'm the executive director of Maine Association for New Americans of Canada.
I'm Sarah Lewis with Maine Access Immigrant Network, and Nathan is with Nathan Davis. Is with Gateway Community Services, and the three of our organizations came together to leverage our assets and our strengths and to figure out how do we not duplicate services, but there's a problem, our community is not talking about it. And we need to get people the help that they need, and we need to figure out how to do this in the most culturally relevant way really quickly. I'll just read my comments so that's clear. But again, we're just very grateful to the MRC's investment in our project. Your support allows us to start the process of truly bringing recovery into the spaces where immigrant, refugee, BIPOC community members already feel safe and connected. Whether that's in our youth programs, in our culturally relevant transportation services, or our trusted community hubs and care management teams. It means we can provide resources in the languages people speak, strengthen our organizational capacity and recovery principles, learn from all of you, and empower our teams to use our expertise and lived experience to deliver meaningful support in the Maine communities, but have it be community-led. With this funding, we're also excited because we'd like to continue working with you somehow or be helpful. We're building the data collection that's safe, especially in these times. Partnerships and safe referral systems that the state has long been missing for the communities that we're serving, so that recovery support is not only available, but fully responsive to the unique needs of the communities. Together, we're creating a model for culturally grounding recovery that can be replicated statewide, hopefully, ensuring no one is left out of the design or delivery of care. And we humbly are very grateful for the support and partnership. So thanks for that, that's all.
Thank you very much for the work you do. Questions that you may have? Comments? Online, I don't see any. I really appreciate the work that you do. I appreciate the fact that the council does, that you came here to share with us today. And we're always looking to know what's going on in the community. We all represent different parts of the state, and we know that there's little pockets. We come together, we can hear that information. We're very grateful for that. But thank you very much for coming here and sharing that with us. And keep up that work, please, saving lives. Thank you. There is no other public comment. We will move forward onto the agenda. I will quickly go through the agenda. I don't think there's any changes. We will do the July minutes. There'll be a short report from me. We'll do committee reports. I'm going to move Joe to the beginning of the committee reports because I think he has to leave it between 3 and 4. So I will move him up. Then we'll do the executive director report, the coordinator report, any new business, and adjourn. So unless anyone has anything to add to that agenda. That is our work for this afternoon. No, all right. So first thing on that agenda is you should have received the you should have received the July, I'm ahead of myself, the July minutes to review. If you have any questions, let me know. If not, I will move to hear a motion and we accept those minutes. So moved. Do I hear a second? I hate that second my own minutes, but no, you can't. I know. You could. It's been moved in second. Any other further discussion? If not, Grayson, could you please call a roll?
Betsy Fitzgerald,
Yes.
Joe Everett,
Yes.
Liz Blackwell Moore,
Yes.
Maggie McLaughlin,
Yes.
Melissa Hackett,
Yes.
Pat Kimball,
Yes.
Paul Vinsel,
Yes.
Reagan LaRochelle,
Yes.
Tess Parks,
Yes.
Sorry, Daryl, yes.
Thank you. Most motion carries. Did we get them all? Okay. Yep. Motion carries. Thank you very much. Next item on the agenda is my report. It will be short and sweet. First thing was I thank you all for receiving my email. It talked about committee reports. And so we've reassigned some of the committee reports at the request of the members and moved them around a little. And we do have 3 new members that we need to assign committee meeting to. Daryl, I took the step to put you on finance. If that's not okay, please let me know. But I heard rumor that that may be your expertise.
That's fine.
Thank you. Rochelle, I didn't have a response from you as to which committee you wish to serve on. Do you have a preference? Are you able to do that now? Or would you like more time to think about that? Sorry.
That's okay. I was also interested in finance, but if I'm happy to go wherever,
No,
there
that is
there might
correct.
be a need.
I am gonna put you on finance. And Jamar who is another new member who's not with us right now, he has not given a preference. So I believe they have to vote on this slate.
Yeah.
Okay, so I have added Reagan to the finance committee. You have before you in the handouts, the slate that was presented before us. And for the new members, I'll remind you that any member of the council can attend any one of the committee meetings. What they can't do is if there's a vote, they can't vote at that. But they're welcome to attend via Zoom and be an active participant in that meeting. They just, when it comes time to voting for a quorum as a recommendation to the full council, it's another piece. Please remember that subcommittees just make vote on recommendations to the full council. Full council has the final vote on any decisions that are made. So if you're all comfortable with the slate of committees that are before you, I'm going to ask that there be a motion and a second.
So moved.
It's been moved. Can I hear a second?
I'll second that.
All right, Paul will second it. And is there any other discussion? If not, can you call a roll, Grayson?
Betsy Fitzgerald,
Yes.
Daryl Stewart,
Yes.
Joe Everett,
Yes.
Liz Blackwell Moore,
Yes.
Maggie McLaughlin,
Yes.
Melissa Hackett,
Yes.
Pat Kimball,
Yes.
Paul Vinsel,
Yes.
Tess Parks.
Yes.
Thank you.
Right, other part of a motion carries, thank you very much for the vote. There is, and I'm gonna let Brendan talk a little bit about it, but there is some question is abiding by our bylaws and by statute and law about financial disclosures. So right now, all the members do a financial disclosure, but we have discovered in this, and Brendan, please tell me if I have this wrong, we've discovered in this, when you leave, you're also supposed to fill out a financial disclosure. So we should be doing it when we're coming and going.
Yeah, that's consistent with Maine statute that applies to certain legislatively confirmed appointees of the governor. For example, a prior member, Ben Mann, deputy commissioner, confirmed by the legislature. In that role, he had to submit financial disclosure forms to the Ethics Commission. And state statute required that he and others in his similar positions have to do so 45 days after leaving government service. I'm tracking down, the legislature's rationale behind that statute. I don't have it. But in drafting the financial disclosure provisions in the conflict of interest policy, I just adopted that language as a way to keep the requirements on the council consistent with, everybody else that, so you didn't have two levels of requirements of council members. And it also, subjectively made sense from my point of view, if the council is giving out, tens of millions of dollars, you probably want to have whatever the state's considered to be, or the legislature is considered to be, a high level of transparency on, conflicts of interest. So that's the origin of that provision.
Any questions in regards to that? Anything you need to fill out or do, we will certainly make sure that you have the proper forms to do it, and we will tighten up on our procedures a little bit, particularly when you get off the council, that we have those forms done. And anyone that falls under the qualifications that Brenda just said, we will make sure that paperwork is complete filed. So, no questions? All right, we'll move on. So I just wanted to share with you that we have been notified by Needle Point Sanctuary. They did give us notice that they had to pause some of their operations, unfortunately, due to a zoning issue where their new location is. So they're currently working with the City of Bangor City Council and the zoning board to figure out what they need to do, but they have not ceased total operations, but they have cut back. Am I not correct on that?
Yeah, so they're still doing the other aspects. They're still using the church where they had previously been located and still doing testing, peer support, like all the other pieces. But to be able to fully operate their SFC, they're not able to do that. AKA they can't pass out syringes until this is resolved.
So it was very, again, and because it had been in the paper and because it had been pressed, I'm very pleased that Sanctuary knows that they are receiving agency from us. This is not a licensing issue with them. This isn't about certification. This is strictly a zoning issue with the City of Bangor, and hopefully, cross your fingers, we'll get that resolved and they will be back in operations. But I didn't know if you have any questions or concerns in regard to that. It was just really a notification to the council. Maggie?
I really appreciate that they reached out and provided that update. It's really helpful and nice and transparent. I'm just curious more about kind of procedure. I know Kazee has also had challenges in operating some, but I imagine it's an open question for all of our recipients. So just curious, what are the expectations for our partners to report when they're struggling outside of a specific grant process with some of these kind of beyond their control elements? And if we're having that conversation around one, should we have it around others? And does that live in grants? Does that live here? It's process question.
So the question is, it should be in contract that if, for instance, if the SSPs are to be certified, so if their certification is in jeopardy, they should be notifying us that they're in jeopardy. Again, Needle Point Sanctuary is not in jeopardy. It's the zoning thing. but they notify us. So there's a piece that if a certification is in question, or they've closed, they're to notify us that that happened as a funder to them. We probably, in hindsight, and probably Chastity can speak on that more than me, we need to tighten that language up in our contracts a little bit to ensure that if something happens, if there's major programming changes or something happens, even if, in my mind, if they merged with another company or joined forces or whatever, that really should come to us for clarification that that's what they're doing. So we know where our funding is going.
Just real quickly, that provision, I think maybe some work is being done to find it, is in all of this, the Recovery Council's contracts, not just the ones relating to rent service providers. And it's borrowed from DHHS contracts and it essentially says, you know, if you have a change in operations or a change in the scope of your project, you have to be in touch with us to discuss it. And I think perhaps even to get approval, but I can't remember that last piece.
Elizabeth is gonna join so she can pull it up and show that part of the contracts, because there's different pieces that people are supposed to let us know.
I guess my question is more like, cause we're in the middle, we're in the middle of contracting the vendor who will be troubleshooting these kind of things. What are we doing in the in-between period when we are notified? Is that going to the grants committee for a discussion, or is it case by case, that kind of clarity?
I don't have an answer for that,
Okay.
but it almost twofold, because that leads into like some other stuff that I've been thinking about is what kind of TA can we provide, what kind of support can we provide to our grantees when this stuff comes up? So it's two separate things to me, but to me, I think that would go program and grant.
You control video.
So sharing screens.
Yeah,
You gotta pull it up, Elizabeth.
yes. At least so people can see this part, so they know the different parts.
Another control in the contracts that sort of helps to bring these issues to the fore or identify these issues are the performance and financial reporting provisions, which I think, you know, some work is going into that.
We're gonna discuss a little bit about the end of the agenda. I think Elizabeth's gonna report those words.
But that doesn't answer your question on what we like doing in the.
So Elizabeth is bringing up the change of operation that's in the contract. They're supposed to notify us if there's 60 days. Yeah. Sometimes you don't have 60 days, but in case of sanctuary, they didn't have 60 days.
And I mean, Willie was great. He notified us before they actually shut down, like this date, this time we'll be shutting down, so we didn't have to find out via other messages.
And we want agencies to be able to tell us what's going on. It's not that we want to pull funding or cease funding. We want to be able to give technical assistance when we can and understand what it is, but it's important that they notify us so that we don't find, again, it's so disheartening if you see it on the news or the paper that funding for the council is not being used as it was contracted out to do. But this is the language if you have any questions about that.
You know, and that some context with the language is that, you know, again, I borrowed this from DHHS contracts, and it might be in all the state's contracts. But I only looked at DHHS style contracts. But an important consideration is the fact that DHHS has people who administer these contracts. And when a provider has a difficulty like this, there's a person that they work with in DHHS about those difficulties. And because the council is building the plane as you fly it, you know, that, you know, whether or not the council wants to mimic that model is up to you. And I think this is part of what the contract management RFP is about. You know, this language sort of, you know, at least lets the council know when there's trouble. But it is missing the kind of, what do you do about it? You know, or technical assistance piece. I don't know that there's a technical assistance, you know, component to how to address problems.
Thank you. Any other questions in regards to this? See any hands? All right. I'm gonna save this one for you.
Okay.
And the only thing else I have on my report is regarding the school subcommittee. And I don't know, Elizabeth or Melissa, if you're prepared to say anything in regards to what's.
No, we have nothing to say, cause
They
we're
haven't been
still-
updated on that.
Okay,
haven't heard anything, yeah, and we don't, yeah, so we don't have the person from the school unit, the school administrative units yet, maybe we do, but we don't, so we have not set a meeting time yet.
And that is still to be determined. We were given a option, but we haven't heard anything back. Grayson made us a spreadsheet of all of the school districts and the contact person, and have been given the option to reach out individually to them to tell them, hey, we have this money, you have like this option, but we need someone from you. It was like 30 some.
Yeah, it's the litigating school districts. It's not all the school
Yeah,
districts in the
right.
state. And, you know, it'd be trying to reach out to them would be the same as the council trying to reach out to all the litigating subdivisions, like however, you know, whatever method would be appropriate to do that, you know, is a possibility here with this discrete group of school districts.
Okay. Great, cause we have a list of other folks we'd like to reach out to invite to the table. We just didn't do it yet, cause I was waiting to have this, cause this feels like it's sort of like the key component. So is your suggestion then that that perhaps you, Chaz, maybe we can do it together, like the three of us, Melissa, you and I can, in an email, reach out to these folks, to the litigating school districts to say, please consider sending us a representative to support, because we need that. We can send them the language that's in the MOU. Okay.
and I thought at one point, I was thinking that maybe the Commissioner of Education could help, but I don't know whether that's helpful or not.
Yeah. Yeah, we can certainly reach out to.
I think we did like 2 years ago, but we haven't for a long time.
All right, so we'll figure it out and we'll keep you posted, and we have a list of other folks that we'll try to get that going as soon as possible. I mean, we wanted to do it in the spring, so we were like ready to go, so I think we've just been, so just so the public knows, this is not like we really need a representative from the school districts to support this work, because it's very specific for funding for additions to school districts' special education. And so it's very specific, and we need a person to really represent the school districts. Great.
Thank you. I
Thank
didn't
you.
mean to put you on the spot.
No, it's okay.
I was just trying to make sure that we kept that open. I think that is I have one other item, but it really falls under the executive director. So I'm going to leave it at that. And that, unless anyone has any questions for me, that is the end of my report. And I will turn it over to Chastity.
Committees.
Oh, committee reports. I don't know where my mind is today. It is somewhere cold. It's too hot. All right, committee reports. I'm gonna change the order a little bit and ask Joe for Program and Grants Committee if he would go first so that we make sure that he can leave at 3.
Thanks, Pat. Yes, I have to leave for another meeting and then hopefully I'll be back when that meeting ends. So the Program and Grants Committee met on July 29th, and we had a pretty lively meeting. And just to highlight some of the conversation, Chastity and Elizabeth and Liz did a great job providing the committee with updates on current contracts, where we're at with those, the outstanding contracts and the process to get those to the finish line. Liz and others did a great job updating us on the prevention contracts, and that's all due to sort of be fully operationalized or in play by the fall. That led to a conversation about reporting, and a couple things came out of that. One, I think Chastity raised the uh, the uh, the the conversation around the terms of each contracts and what happens when people don't spend their money in a lot of time. And those of us who've done projects know that the trains don't always run on time. So people request no cost extensions to the funder. So the group agreed that we really needed to get, language or policy in place for no cost extension that grantees could submit to the council, the staff, and the council. So the staff, Chastity and Elizabeth, are going to work on a draft of that. That led to sort of a conversation around allocation letters. So now we've been working and we're kind of still in our infancy. So people get notified that they are being awarded funding. Eventually we get contracts signed, but many of us who have many contracts at our organization are familiar with allocation letters that outline some sort of the key details of your award. So I think we decided that staff would work on developing those letters. That led to a conversation around off grant cycle emergency requests, and that the council has talked a lot about a policy around that. So staff are going to work and bring something back to our next meeting or an upcoming meeting around a policy for that. We also had a lively conversation about community needs assessment and our requirement and desire to always be taking the temperature around community needs. So Tess did a great job providing an overview of MeRAP's many, many, many listening sessions, which was fantastic. Pat did a great job sort of reiterating the work of Dr. Kim Johnson. For those of you who don't know, Kim worked with us in our early days with the council, so Pat recapped that work. And then I provided some information, and then I think I sent the links to the entire council on the Maine Community Shared Needs Assessment, China, that the community action agencies and the hospital systems did together. And then that led us to a conversation about the fact that this is a ton of data and a ton of robust, fantastic information, and that staff cannot possibly take up synthesizing and analyzing all of that information. So at the next meeting, we're going to talk about if we need external help, a consultant, how we go about sort of looking at this information, someone looking at it, digesting it. And there are groups like the Cutler Center who do that and that are already doing things of that nature. So we're going to bring that back to the next meeting. And I think that was it. But Chastity, did I miss anything? Or Pat? Or members?
No, you actually covered way more than I was expecting, so you did excellent.
It was an excellent meeting.
It was an excellent meeting. We're back to an hour. So if anyone would like to join our meetings, they're no longer 2+ hours. So we're getting it back to an hour. And then the next meeting will be August the 26th, and we'll pick up some of this work. And Pat, you kind of touched on it, but it hadn't happened then when you just, I think, casually mentioned President Trump's latest executive order. And I think at some point we'll have to take up that conversation since we are no longer allowed to talk about a major pillar of our work. So we can talk at the council meeting, Pat, or wherever you see fit to talk about how we move forward with that. And that didn't get talked about in the meeting, but it's on my mind and on the mind of everyone at the Opportunity Alliance. So, but anyone who would like to join us later this month, please feel free to do so.
It's one of those things with all of what's going on federally that we really need to cement our, I'm calling it for lack of a better term, non-grant cycle financial requests. to be able to assure that all of the pillars here in Maine are able to continue despite some real challenges with losing federal dollars. And so what is the role of the council in being able to do that? But Joe, thank you for that, and we'll certainly add that to already your busy committee, but thank you. And while we're on the subject of program and grants, did you all, I'm in love with this,
Yeah, this thing is great.
with this chart, if y'all haven't seen it. They put it together, it now is all the agencies we fund, how much we funded for in one little location. Cause every time somebody asks me, I think, how much was that? And then I'm Googling, trying to figure out where is that chart? So we now have it in our hands, which is great. And who we funded and how much we funded them for. And Chesky even has here color coded as to which pillar, and also whether they're a planning grant not fitting in to any particular pillar. So it is very well done, and thank you for that. All right, Joe, thank you. Any other questions for programming grants?
I have a comment.
Yeah.
The comment about not being able to talk about harm reduction. I'm not gonna speak for Willie, but I believe that who he's providing the training for is saying, don't say harm reduction. The policy, as terrible as it is, I hate it, the federal policy. I think that those are the implications of it, even though that executive order didn't change anything, so to speak, about what can or can't be funded with harm reduction stuff at the moment. It's the cultural shift, the politicized stuff like that was what the real harms are. So I just wanted to clarify that people can talk about it, but that's like the ripple down.
Yeah.
I'm not aware of that, executive order. Can someone summarize that for me?
Do you have your
Yes.
colleague letter?
No, it's executive order, Paul. It's called Ending Crime and Disorder on America's Streets, and it came out July 24th. And it's calling an end to harm reduction strategies, really not just names, and also calling an end to the end of Housing First program. So I can send the order around to people. It's also very easily, and of course there's a ton of pushback from major federal groups, but it's a not to go down this rabbit hole, but it's very similar to EDI or DEI. So any organization who gets any direct federal funding will be prohibited from engaging in those strategies. So it's hot off the press, and it's very upsetting. But you can check out the order, and there's also lots of folks who've done sort of extraction of the key uh, requirements in the EO.
Yeah,
Thank you.
the Consumer Council has put out a lot of information in regard to it, because it has a lot to do with about homeless and how we deal with homeless and mental illness, particularly those those with mental illness who are currently unhoused, and what is happening. So there's a lot of concern out there.
And just one other thing too, Paul and others, is that there's language around forced treatment. Well, most states don't have a facility like AmHi or BMHI, so it's really archaic to use some word that was used. It's just the system infrastructure doesn't exist for that, but it's very scary and upsetting. Sorry, Pat, I didn't mean to cut you off.
That, please don't apologize. Nice.
I know that Melissa's texting me. She wanted to ask a question. Can you she just can't raise her hand on there for some reason. Melissa, oh, good, you
Driving, just my third hand there, Melissa.
Yeah, go ahead, Melissa.
Thanks, Liz. I didn't want to just bust into the conversation. So this isn't necessarily for Joe. I just offer it to the council generally I think it's really great that there's a conversation about creating an emergency funding policy and process. And I also just wonder what we're doing in the meantime. I imagine that those requests are coming through in the interim in which we are developing that. And I just wonder how we are going to handle those while we're doing the rest of the process.
I have a couple of things on that. One, I am really concerned if we address anything as emergency funding, because from vote to money out the door is never gonna be quick, and I don't wanna set that expectation up for people. And what to do as the requests come in, that's one of the things I wanna talk about when I do my report, is also asking how you all wanna receive that information, because we have been getting some. So to be determined shortly.
There,
Thank you.
there was discussion of it, I thought, in the finance committee about like available funding. and,
Correct.
You know, and how it would impact the sort of planned budget and, you know, what funds have been allocated or, you know, what's available, things like that.
So finance is, because it's never simple, it's the council. And Deb is the treasurer's really digging deep into looking into how much money we have and what we don't have, what we have already promised and given out. And how much, if we have any addition coming in, interest coming in, but also at the same time, if you remember that chart that goes out 18 or 20 years, there's a couple years in between because of the way the funding goes, we're actually going to be in the red and not in the black, and we don't want that to happen. So we're trying to figure out the best way where we can have this continual fund, but at the same time know if we have access funds that aren't being used, we don't want that accumulating, we want that out in the community and doing the best they can. So Deb is put out, and the finance committee is looking into really digging into the budget and coming up with some real numbers. So when these requests come to us, we know whether we can afford to look at them or not. Can't spend money we don't have, unfortunately. So she is doing a great job. She's on vacations, so there will be no finance report. But know that next month, hopefully she'll be able to give us some numbers, so we know what we're looking at and how much funding we have. All right, Joe, if you're done, so shared finance won't be there, and we're gonna turn it over to Paul from governance. Thank you, Paul.
Well, thank you, Pat. So the governance committee met, July 25. We had a robust discussion on several things, and Maggie did just an awesome job on the minutes. The first thing we discussed was about the clerk of the council. Our bylaws currently state that the clerk would be an employee of the Attorney General's office. And we went over, and Grayson had supplied us with a kind of an overview of what the requirements of the clerk are, and you can see those down at the bottom of page 1. They list them all out. And we voted to suggest to the MRC that the MRC amend their bylaws to state that the clerk is appointed by the chair of the council, will be either a current member of the council or a current member of the council staff. The chair may change the clerk appointee from time to time, and any such change may be altered by the council pursuant to section 4.7 of these bylaws. I thought we had a really neat discussion after that about the appropriate power of the level of the chair. So what this would basically say is, yes, the chair may change the clerk appointee, but that would be pursuant to a vote by the council and have to be approved by the council. And even Pat, who is the power, she is the chair and holds all that power right now, thought that that should be written into that that bylaws change. So that's where we would start. We would recommend that that occur. And should we vote on that after my whole, the rest of my report, or should we do it now?
Let's just do it now. It was fresh, I think. You all have a copy in the handouts of the article change.
Maybe. It might be helpful for people who aren't in the governance committee if somebody can share just a brief blurb on what the clerk is and isn't. Sorry, if, I don't know.
Might be best if Grayson does it, because you don't know.
Just that current
What
clerk
is the
would be
clerk?
helpful.
So I actually just got all of the reporting caught up. So it's very fresh in my mind. But basically what I do as the clerk is I report the meeting information and the expense information. So for Zoom meetings, for remote meetings, I don't report any expenses. I just say how long the meeting was, how many people were there, what the date was, that's it. For in-person meetings though, I go through and report on the mostly admin expenses of the council. Like I don't report on like the grant money going out, but I report on like travel reimbursements, any things like gov delivery that the council uses to put out notices, things like that that are expenses, not necessarily functions of the council. And then at the end of the year, all of those monthly reports get compiled into a big annual report that has to be turned in by certain dates, normally end of the year. The monthly reports, you can go back at any time and add to them or take things away, but the annual report is final. You cannot change that. And yeah, that's about it.
And that's reported to the Secretary of State.
Yes, sir.
And the Secretary of State's office produces a manual for clerks about the reporting it requires and ultimately makes available on its website certain information that the clerks provide, such as information about the board members, information about the expenses, and so things like that.
Any other questions about the position of clerk? Any questions about, oh, did you just?
No, I'm.
Oh, you just
waiting.
just waving.
I'm waiting.
She's just waving. If not, can I hear a motion that we accept the changes to the bylaws as presented?
Sure.
So move.
Been moved to debate, Tori's here a second.
Second.
Been moved in second. Do I hear any conversations or questions to clarify? If not, can you, oh,
I have a question, I'm sorry. It's kind of a question for Paul. So what I included in everybody's packets and what I changed the Word doc with of the bylaws doesn't talk about a vote from the council, it just says by the appointment by the chair.
No, I think, right, I mean, I think the idea was, if I recall the conversation, it was that the chair would have in the first instance, the ability to appoint, solicit from the council or from the staff, who's willing to do this, and the chair would have the authority to appoint. But the council could undo that or could change that by vote, and that's the reference to section 4.7.
Okay.
so that's that last line, and any such change may be altered by the council.
Okay.
But that's my recollection and understanding.
Yes.
If those of you who are on the committee think otherwise or recall otherwise.
What was your point, Grayson? I'm sorry.
I just wanted to make sure that I hadn't missed something, because when you were talking about that, I was worried that there was supposed to be something in there specifically mentioning a
No,
vote.
I was ad-libbing there.
Okay. Thank you.
All right, if there's no other further discussion, can you call a roll, please?
Yes, Betsy Fitzgerald,
Yes.
Darryl Stewart,
Yes.
Joe Everett,
Yes.
Liz Blackbone,
Yes.
Maggie McLaughlin.
Yeah.
Melissa Hackett,
Yes.
Pat Kimball,
Yes.
Paul Vinsel,
Yes.
Tess Parks.
Yeah.
Todd Bartlett.
Yes.
Thank you.
Thank you, everybody. Motion carries. All right, Paul, thank you. Continue.
Okay, the next thing we discussed was the public forum. And we had discussed it a little bit in the previous meeting and then last month at the MRC meeting. And so we decided that it would be a one-day meeting. It would be a combination in-person and video. And we thought because it would be a combination of video and in-person, that we could actually maybe have it here if that's available for that day. In this office, which I think would be kind of nice because we're familiar with this. We talked about dates in November. or December, and we typically have our meetings the second Thursday of the month. So we looked at the second Thursday, and I think we looked at this. Did we look at the second Wednesday too, or the second Friday? or-
Thursday and Friday.
Thursday, Friday. And Elizabeth put out a doodle poll, and you did that, right? Do we have the results?
Looking up right now.
Okay.
I don't know how many responses we got, so let me. I think being in here, the Wi-Fi would be like a little bit faster, but it's so much slower. Right now, we are looking at. It's not even, this is August, so that's not. Right now, we're looking at November 13th. From 12 to 4. We only have,
That's number one.
yes, we only have about 6 votes on that, so that's not even quorum. So I will send that link out again today for everybody who, and obviously new members have been able to participate in that poll, so I can redistribute that link so we can finalize that date. Because I know we also want to secure this room before it's booked up.
Now that November 13th is the second Thursday, so that would be the date that we have our normal meeting
Correct.
here, which would be really nice for all of us, I think.
Yeah.
So do we want to just pick that date right here while we have a majority of people?
And we have quorum,
We have quorum.
let's do it.
All right, so, does anybody have any objection for November 13th? Approximately 12 to 4, that we hold our public forum like we have for the past 2 years?
I unfortunately will be away for a drug policy conference, so I wouldn't ask to change to not be here. But I just wanna put that out there. I know ahead of time that I won't be able to attend.
Right, so Tess, I feel bad about that. Is that? Okay. Okay, so do I hear any other objections to that? I don't think we need to call a roll. I'm gonna take a consensus that right now, as it stands, we're gonna aim for November 13th from 12 to 4 for a public forum. And we'll put that out to the members who aren't here and see if, but otherwise, I'm pretty sure that that's what we're gonna do. And Tess, I feel really.
Grayson raised the point that this room may be too small for the number of people who may be, who may attend. So I don't know if people have ideas of other spaces that we could possibly use.
What was your experience with the sort of numbers of the last couple of meetings?
The first one was more populated than the second one, by far. And I don't even remember in the first one, that room being full.
No, it wasn't full.
Because people would come in, do their thing and leave. The question would be more is, does this building object to people coming and going that much in this building? Would probably be more of a question I would ask. Because you've got the general public coming in and out. For 4 hours.
Right.
So you may want to ask them more than, I don't think, I mean, instead of using the tables, you could just have chairs.
Yeah, I just wondered about capacity. Do we know what the actual like legal capacity in the room is? Because it seems as if, given how many people came last time and that we have open public comment each time. I wonder, like last time, the people that were here last time would definitely have fit in this room.
Yeah.
If those were chairs and we oriented towards them in that way, in a line, we could definitely fit them. But I'm just wondering, what's the legal capacity?
Those are the questions I'd have. Yeah.
And with this being online, by Zoom as well as in person, I think that might decrease the number of people that come from Fort Kent.
Yeah, and we didn't offer that before.
Yeah.
I believe we may have been on the Zoom, but we did not offer the capacity for people to come in the Zoom, so. Which again, and I know that we had people who spoke, said they drove 3 hours, 4 hours. They're not gonna do that if they have the capacity to do so.
The council has discussed in the past whether to hold it in Augusta or to move it around. I think you all have settled on Augusta.
I think since we only have it once a year, it doesn't make that much sense to move it around to me. If we had it every couple months, then yes. But
And the difficulty really is, particularly this year, if we're doing a Zoom, we need to know it's a place that our team can make it happen. If we go someplace else, we sometimes lose that capacity for the internet or what's there, what's not there. And I truly would hate to go somewhere and promise people they come via Zoom and then it doesn't work. This way we know here we can make it work. We've never done it at the Augusta campus, but I'm sure we probably can. But we want to be able to have the capacity to be able to ensure that if we say it's open to the public on Zoom, that it truly is. So that would be my only thought. All right, we have a date. I'm gonna put up things. We have some questions about space that we will work on. All right. Oh, what else we got?
Oh, I'm having a moment here because I'm trying to take care of a toddler for the last 4 days. The last line of public forum, Maggie says, put it on the agenda to discuss if we can be more strategic about transitions and handovers in the election of.
Oh, that is around. Yeah, I take care of a toddler too, so bear with me, but
I take care for 70.
I think we were discussing kind of the timing of when we would mention the election of electing council members and different roles. And part of that discussion led to a conversation that many individuals will be transitioning out, and many individuals currently in leadership on the committees will be transitioning out, and so we should potentially be more strategic around deciding who, I mean, I think we all want everybody to volunteer for whatever they feel comfortable with, but that we maybe should have a conversation around strategy in some of those transitions to make sure that there is a bit of a intentional handover.
On the committees?
Yes.
Yes, from the council, yeah.
Those elections, I think there was some debate around numbers. It's voted on in January, but we need to give 30 days notice. So that led us to originally think we had to do it during the public forum, but then it sounded like maybe that didn't have to happen during public forum.
No, we did it during public forum last time because people were.
It was in December.
It was in December.
And we have to vote on it in
And the
January.
terms were up. Yeah, the terms were up, so your term is up. No, your term is up after the election at the annual meeting, which isn't necessarily January, but it's the first meeting of the calendar year, which is probably gonna be January. So, and then the council needs to have a 30-day notice of who would like to serve as an officer. So that's the timing of it, that the governance committee has to put out sort of an all-call saying, if you'd like to nominate someone to serve in an office, so that we give council members a 30-day notice of who those are before the voting at the annual meeting, which is the first meeting of the year.
So I think when we make the call for new people, or not new, but positions on the committees, maybe what we could do with that is state who might be leaving the committee explicitly, like these transitions are in the works, and then as you choose to raise your hand or not, factor that into justifications and how you would approach it, and then go from there.
Okay. Then we talked about needs assessment. The needs assessment We felt that, and we talked about this at the last MRC meeting, that the needs assessment should look at priorities for our next funding cycle and understanding they may be completely different than those of our current funding cycle, especially given the decrease in funding from federal sources. There's a lot of data out there, and actually Joe had talked about this already, and Pat, you sent me an email regarding this. Can you kind of summarize that? Because I had a difficulty following.
Oh, I'm sorry. So, Paul actually had a great meeting, with the Moss Center
Yeah.
in regards to the work that they're doing. But then when Chastity and I were talking, there was two committees both talking about the assessment, and it seemed that was redundant. So after discussion, we think probably that needs assessment needs to go to program and grants, not necessarily under governance. And so that's basically, we didn't want two committees doing two things.
That makes sense.
Yeah, so it probably belongs in program and grants, but I do know that you had valuable information, and I believe I sent it on to Joe and Chastity.
Yeah.
If I didn't, I can resend it. You had a great meeting with the Law Center and you may wanna come to program and grants and talk about that
Okay.
with them, as to how they can help us, what they're currently doing. And how can we piggyback off of that to assure that we have the numbers and the data needed to dispense the next round of funding.
Yeah, Joe, I did have a really good meeting. I'm sure they'd be willing to meet with you also. Okay. And last but not least is the discussion we had on the executive session. Kind of a consensus that when we did our last grant application, that discussing those grants applications in public, it was difficult for the applicants as well as the staff. And how do we get around that, given the Freedom of Access Act? And it was pointed out that there are some committees, not the MRC, but other like governmental organizations, that when they do a grant, they discuss the applicants in a non-public meeting. And then the notes are made public, and then they discuss the results of those discussions in a public meeting. It was pointed out by Brendan that those procedures are authorized by specific statutes that govern them. And the MRC does not have that in its statute. And it was felt that the solution is for the MRC to amend the statute, or well, we can't amend it. The state of Maine would have to amend the statute that governs the council to allow the council to discuss grant applicants in a non-public forum and then present the results of those discussions in a public forum.
Oh, they went black.
TV.
Oh, there they are.
Look at the rain.
Oh, look at that rain. Whoa.
Did anyone leave their windows open?
Mm-hmm.
No, the car's right.
Grayson did. So we talked about that, and I don't know how to change statute. But you would put forward a piece of legislation, and it would be assigned to a committee in the legislature. And it was felt that this could be done relatively quickly.
Because there's no fiscal note.
Yeah.
There's the key. If you're asking for statute change and Representative Stover was there. If it has a fiscal note to it, it becomes a whole other issue. This is literally just a change in procedure, but not in, there's no fiscal note. So she said that would help you. Now, whether that made it faster or not, I don't know, but it would have. Yeah. And more to come, I think. We're
Can I
working.
just clarify a
Yes,
couple things?
yes.
So I've looked into things a little bit more, and as you all know, the Recovery Council's meetings are required by the Freedom of Access Act to be publicly available or publicly accessible meetings. And the statute, FOA, that requires that says you have to do that unless or except as otherwise provided by statute. And that's the provision that sort of requires there to be a change to the statute. I've since learned, the council's meetings where it discusses applications and other things, have to be public proceedings. When other state agencies, my limited understanding of the way other state agencies administer RFP processes is that, when people who review those grants meet to discuss them, those meetings are not required to be public meetings. At least one reason is because the requirement that the council's meetings be public doesn't apply to state agencies. The council is the kind of agency, the kind of entity that public proceeding requirement applies to. If a group of employees at the AG's office or at DHHS get together to have a meeting, those are not required to be public meetings. So that at least is like one reason why there's a difference there. So everything the council does, where it's a couple of council members or more, has to be a public proceeding, no matter what you're talking about. And that's sort of the background for that.
I know other things, if we wanted to change it, all of the litigating subdivisions needed to agree. Would we need to get them to all approve this to be able to change the statute?
So the litigating subdivisions are necessary to make a change to the council's MOU.
So not for this.
But in order to comply with FOA's requirement that says, except as otherwise provided by statute, it's really the legislature. I mean, they, may want to hear from, anybody who would be impacted by, trying to make things confidential, including the litigating subdivisions, but it's not solely a subdivision issue.
Yes, this is something that we wanted to pursue sooner than later. The deadline for submitting legislation for January is the end of September. So I'm just curious how people are feeling about it. Do we want to take action? Who would be taking that action?
I can only speak for myself and my observation. My observation is that with this particular change, that the council felt very strongly that they did not like the way that we did the grant process the last time, that it wasn't that we were trying to do something in private, but we felt we couldn't have the open and honest discussions that we needed to make the decisions to do our work, our grant work, because everything had to be done in public and people held back saying some things as to why they scored it that way or questions they had because it was very public. It also made it very public that people, before we could even notify people, that's how they found out whether they got the grant or not. They watched the Zoom. And it was very upsetting to people and awkward for people to find out that via a Zoom, not being an award letter or a nice little thank you letter, which is never easy to get. But so I felt that in my observation, the council felt very strongly that we needed to make steps to change this. But that is at the pleasure of the council. That's just my observation.
I agree with you, and now the question is, how do we get a statute written or proposed by the end of September?
Need a bill sponsor and draft language submitted to the revisor's office. I think it's the last week of September, but we probably should aim for that, especially if we wanted to review language as a council for September.
So with an agreement with the board, would you get together with Representative Stover and look at that and see what you would both believe is a recommendation for the council? Are you comfortable with that?
In terms of the language, Brendan, do you have any interest?
I'm not sure I'd be permitted to do that. I think, when the legislature drafts language, they have the revisor's office that, helps legislators with that. But I can run up the chain in my office and see what the limits are on my ability to help them.
Yeah, I think as long as we had a pretty good idea of what we want in it. I mean, in my personal experience, I've seen the revisor's office come up with things that don't exactly match what's needed. And the legislative process opens up opportunities for amendments, what have you. So my preference is that we as a group would have language that we were sticking to. And that's what we're going for. And
Yes.
not leaving any opportunity for other legislators, committees to make any changes other than what we're requesting.
Yeah, it would be, in my view, narrow.
I think I'm wondering that because I agree, and I wonder if we wanna agree, have a motion that we agree to the idea of narrowly working with a legislator to create legislation that would change the statute so that we could be able to have meetings that are behind, not in public, but then public proceedings be shared when we're making decisions around grants. And that we do that now so that we agree upon that, so that then if it's you or Representative Stover or whoever it is working on it has the backing of the council to do that work. I wouldn't want you to do it and then bring it in and us be like, no, we don't like that, or that's not what we thought. So perhaps we can do a motion now on that.
Just want to ask a question, but your hand is waving, the general duration of the question.
It is. If this language exists in other places, why are we reinventing the wheel? Why don't we just go over there and say, there it is?
It may exist.
I think what I'm saying is that we give a group of people the ability, the backing of the council, we vote on it, to go and do that, and then write it and come back to us, because September, it's August. Our next meeting, we would have to vote on that, to do that, to get it in, the actual language at our next meeting, which is on September 11th.
So,
I missed, there was a meeting a couple meetings ago, as I understand it, to discuss feedback that the council received and its analysis of its grant process. And of course, I missed that meeting. I took a look at, I found, or Grace found, or maybe it was Elizabeth who found for me, one comment from somebody, but I haven't found additional comments. Is it just the one comment that?
No.
There were more comments?
I believe when Sarah came and presented to us, and I'd have to look at some of the charts that she gave us, I believe that it had come out from both from council members. It came from awardees who received grants and awardees who did not receive grants, that they found it to be embarrassing. And some other comments, but we certainly can look at Sarah's report. But if I remember, there was more than just one comment made, and particularly the council itself felt very uncomfortable. And those who sat through the interview with Sarah. But she said it was from all angles. It was from the council, people who received funding, as well as people who did not receive funding.
I also think, sorry, Liz, I can't go.
No.
Sarah meeting with everyone, she didn't get to meet with everyone that was part of the process. Like, I didn't get to meet with her. Other people that weren't on the council anymore didn't get to, that had strong feelings. And just anecdotally, I could probably rattle off a dozen people who reached out to me while I was a council member about that process. And like in the middle of while we were doing it, texting during it with trying to clarify things or offended, so more than one, just not on paper.
And the people who are the sort of, this comment talks about, some inaccuracies that were stated. It sounds like people are saying, I have questions or whatever. Are those kinds of issues, the kinds of things that would be resolved by confidentiality or by some other fix to some other better process? Like, I guess I'm trying to understand what confidentiality would fix.
Liz?
One, I think there are questions that come up along the way that need to be asked of the organization for clarification. And when they are voiced in this public space with no one to answer those questions, they can be perceived as truth or they're asked of an organization, which we did. We went back and said, hey, we have some questions, but we had to voice those questions out loud in a public forum that can be detrimental to organizations. Two, I think there's a lot of ways in which council members don't say things that maybe they have questions about because they know it's public proceeding. And I'm not gonna make that statement of like, well, I have a question about this, about something, because I don't wanna be perceived as throwing an organization under the bus or, or I actually have a legitimate question, but I know if I say it, it might be, again, perceived as a truth before we actually have the organization to answer that question. And so I think those two things alone to me are reason to do it, because they are things in which if they don't get voiced and we don't ask the question and we just silently keep our mouths shut and say, okay, I'll vote for it, but we have legitimate questions that then should be asked about someone's ability to do stuff. I think when we read these, I actually sometimes had questions knowing what the work is. Can this organization actually do that? Like, I have real questions about that, and I don't know that we got all the answers but I'm not gonna say that out loud in a public setting, but I would like to know that answer. So I think the confidentiality allows us to ask the question and then say, how are we gonna find out the answer to this question?
And, for those of you, I don't have experience with either making grants or receiving grants. So those of you who do, this is for you, which is in that, in that situation is when grants are being reviewed, is the decision being made on what was submitted versus, what was submitted plus, like, is it normal in a grant process to look at what was submitted and then say, look, I need additional information, or is the decision made on what was submitted?
Really depends on the grant making entity. Like, there are grant making entities, the state would never come back and ask us questions about it. This is on like, here's the number, here's the score you got, here's who gets it. There are many grant making entities that are willing, they want people to succeed. They want work to happen. I'm not saying the state doesn't want people to succeed. I'm saying that the grants are put out for solving a problem, and we have a problem that we want to solve for in this county because we know this thing isn't missing, and we'd want to work with an organization who's close but needs some support or we need more information on. I think it's a real question about what kind of grant making entity are we, and I don't think we had gotten far enough to like sort of understand that. And I think that's part of why we've been talking about wanting to have TA built into the grant making process for those who want to be a part of it, so that we're getting people to the place where they can put in proposals that are the best possible proposal, not ones that are like, well, let's just score people and then, you don't get it because you didn't score high enough, but we're like, but this is a great project. But I want to know, does it need to be scaled back? I think it's, Megan, I cut you off. You were gonna say something too about it.
I have never been involved in all the years, been involved with a grant whether they were closed question grants or open-ended grants, that publicly the awardees were notified on a Zoom. They were sitting there listening in on whether they got it or they didn't get it. You were always either notified either by email or by a letter saying, thank you very much for applying, you got it. No, thank you very much, it was great, but no, you're not get it. I have never been involved, and I can't imagine being on the other end of that Zoom, hearing my project I put my whole heart and soul into on a Zoom just got knocked down. Again, not that a letter is any better, it's still hard. It's just so public that you don't even have a chance. And again, we decided because geographically we were looking at gaps. And you could have been sitting in that meeting and seen your score was higher. But we then said, no, well, we're missing, a special group here, we need more, or we're looking at geographically is where we are. We also were looking at within the pillars, where were we within the pillars? So by listening to that meeting, we want to be able to make those decisions, make it public. And then if they have questions about why we made it, we certainly would answer that question. Why did I score a 75 and this one scored a 76? And the 75 got it and the 76 didn't. But we had to do all of that work publicly. And I think because of it, it was perceived in a not good way. I
also think a lot of concerns didn't get raised, people had, because it was very public.
And again, not that,
It also threatens the viability, sorry.
Go ahead, Maggie, please.
One justification could be it threatens the viability of the Maine Recovery Council to access the widest pool possible of competitive grantees because they feel the public discussion could threaten their reputation. And so they'll self-select that. And so it's in the best interest of the Recovery Council and the wider community to have a more protected conversation.
And you can be public with your stuff. I mean, I just reviewed all the peer recovery center grants, who got them and didn't get them. It's public information. I know who scored what, and how they scored it, and who scored low and who scored high, who was getting, it's public information, and the council has every intention of doing that. What we don't want to be able to do is have, before the letters, awardee letters go out, that we have very public conversations about agencies. I think they deserve a right to disclose to their own board why they didn't get what they didn't get. And not have it on a Zoom.
I would take that one step further, Pat, say that I think we have a right, a responsibility as a council, we have a limited amount of funds to, these are tough decisions that have to be made. And we have the right to, this is real property. I guess probably not by definition, because I looked very closely because, anyway, this is, the money is a tangible asset, whatever you want to call it. I don't know what the right legal term is, but it's not real property. In other words, it's nothing you can walk on. I suppose you can walk on it, but you know what I'm saying? It's, we should be able, if we have to make these stuff, we should be able to have those discussions and then make the decision documents public.
Correct.
You know what I mean? And I think that would more than meet the spirit or the intention of the freedom of access law.
Yeah, I do.
Right.
I do. All right, so for the sake of time, we're looking for a motion that that we pursue a statute change for the Maine Recovery Council in regards to and for lack of a better word, how we do our grant process. And that we appoint a member of the council two members of the council to review and bring to a full council meeting a recommendation for that statute change.
If we do it 2 council members, does that have to be made public?
Yeah.
Their meeting?
Oh, no, their meeting is just writing a draft.
Yeah, that
would have to be public
at least that's my advice.
if you have 2.
Do we have to say who it is? Can the motion just be that we want to do this?
Yeah, let's just do that, we'll figure the rest out, let's figure the rest out. So right now, we're just gonna change that motion that the council has decided to pursue statute change in order to review our grant process so that it's fair to our members of the community who apply for our grants.
Would be more narrow, can we, and say to make our grant making process deliberations confidential?
Okay.
Is confidential the right word or?
I'd say exempt from the public meeting requirements of FOA.
To make our grant making deliberations exempt from the public meeting requirements of FOA.
So do you make that motion, Maggie?
Yeah.
Do you want to hear a second? Paul seconded. Any further discussion on it? If not, can you call a roll, please?
Betsy Fitzgerald.
Yep. Trying to get this meeting back on.
Carol Stewart. Liz Blackwell Moore.
Yes.
Maggie McLaughlin.
Yep.
Pat Campbell. Pat Campbell.
Oh, yes. I'm reading a message from Joe.
Don't worry. Paul Vincent.
Yes.
Tess Parks. Todd Parker.
Yes. Joe excuses himself, but
Grayson, how many did you get on that? Cause you get it, okay, thank you.
thank you, motion. All in favor, motion carried. Thank you very much.
I was scared for a minute though.
Joe had to leave the meeting because he lost power.
Grayson, when did you live in Reagan for a little while?
She hasn't done her financial disclosure yet.
We're excited to have you come to
We are.
our vote next
Sorry about
time. Quick question on that, if Brendan does not get the approval up the chain to work on this for us, I don't know enough about the process, will you need money to consult a lawyer to do this?
No, you don't.
Alright.
I don't even really need Brennan to write the actual link, right? Even just like a summary of like, this is what needs to be accomplished.
Mm.
'Cause I'm
Yeah, we
not
just need to get a
aware-
summary in
And I
for
don't
the
wanna
date.
attempt to give the revisers an idea without guardrails as a protection for us.
Yeah.
I'll give an answer on what the limits are of what I can do on this project.
And I would like us, I agree with Betsy that if this statute exists for other organizations, let's just take it and submit it.
Yeah, I'm aware of statutes that say that public records can be kept confidential. I would need to do a little research, but various committee staff probably have information about public proceedings exemptions, so a legal distinction.
And it's probably no help because it's not apples and apples, but we discuss labor contracts, with variety, with a varying entities within our, and there is an exemption for that, right? Specific. Isn't that exactly what we're talking about? We're trying to decide who's gonna get the contract, right? So
Correct.
so it seems to me that there's some similarities in what we're trying to accomplish. We're not trying to be secretive. All that stuff, including whatever the final contract is that comes out of labor negotiations, is public information. It just seems like, to me, it's probably not similar, but it seems like it is.
Yeah, from my read of the statute, I don't think it's similar. I think that's more about the employment context.
I understand.
And, that certainly employment is very clearly discussed as permitted under executive session.
Well, I understand that, but
I tried to make that same
no,
argument.
I'm not trying to argue, I'm not trying to argue that this fits into that statute.
You're
That's
just
not-
trying to say there
I'm
are
just trying to say,
situations.
in a labor situation, management knows how much money we have and can raise, via taxes or whatever. So we have those parameters. So we're just trying to, you're right, it's about terms of employment, but it's similar to me in the sense that we're gonna have a contract with each one of the ones that receive this funding. We know what the funding is, you know what I mean? We have to make those, so it just seemed like it was similar,
Yeah.
that language might be similar in the sense that it would be a limited focus, you know what I mean? And those deliberations couldn't bind the whole council, just like contract negotiations can't bind the whole government entity. Has to be, you know what I mean? All those other steps have to happen, so
Right.
that's probably a bad idea, but it just seems similar to me in general.
Yeah, I get the point.
It's never easy. It's on them position. Thank you. Go ahead.
One more thing on the governance committee, so typically our next meeting would be the fourth Friday. But because of how this month started on a Friday. The fourth Friday is the next Friday, the 22nd. And we have not put out the agenda 2 weeks before. So I do think that we should have a governance committee meeting specifically for this, the statute change. And would it be okay if we changed it to August 29? Which would be the 5th Thursday, be the last Thursday, so typically the 4th is the last.
I have no objections, but you may wanna just double check with the committee, that is the Friday before Labor.
Which, do you say the 29th?
29th.
That's a Friday.
Yeah.
We meet on Fridays.
Yeah, we meet on Fridays.
We meet at 11.
Yeah, he said Thursday, but he didn't mean it.
Sorry.
I'm getting my hair cut, not.
I'll show you the toddler I've been taking care of.
So just to be clear, you want to have a meeting on the Friday before Labor Day in Maine.
I have jury duty, I can't make it.
I tell you, the minute you tell me your occupation, you'll be kicked out of
I
here.
can't wait, I'm gonna answer. I'm going to Portland Recovery.
Okay, so Paul, why don't we tomorrow send out some sort of thing to the governance committee and throw some dates in for that following week? Well, you're gone all week, Tessa. Your duty's never one day.
We could maybe do it on September 5. That would be the first Friday of September. That'd be better?
Better than the day before Labor Day.
Yes, September 5th work.
We're
Ted,
in
does that work?
agreement on that.
Are you still doing
Is that
jury?
11?
Huh?
We meet at 11 AM, right?
Yeah.
Yes, that should work.
Okay,
I'm not gonna get selected.
all right,
No, you're out.
September 5th.
Okay. Governance committee will be September 5.
All right, Paul, anything else to report?
Oh, no, you're not.
So Paul, anything else? We got the date, we all set?
I think that's it.
All right,
I think that's it.
executive director's report.
My report's more asking you guys all kinds of questions.
Okay.
First, we'll go really simple because you already have it. Please appreciate my color coding.
I do.
I spend more time than I should have, even though a lot of this already existed, but at least this way Elizabeth's gonna email it to you all, so you have everything. I know when people ask me what projects we funded, I can't remember without going back to look. So we've got it all there with the full amounts. I will say there is one that says $10,000 more than it is. That's wrong. It was, it's a Maine Works.
Yeah, but they did get paid the correct.
Yeah, so it's 10,000 over, but they got paid correctly, but you all have this.
Maine Works Northern Expansion. LLC.
Yep. Just 10,000 less, okay.
Yeah, it was just a typo in the original chart I pasted from.
This is
Maybe
great.
fix it. This is gonna come into play in other, this Joe, when we get into some of the other questions to figure it out. RWI, the Piscataquis County Recovery Center just completed their first full year. They sent a report. Elizabeth is gonna review some of the stuff they've accomplished in their first year. The people, first place that received money from us, obviously, like, everyone wants to know how it went. With that, though, they have already inquired about funding after July 2026. They didn't get the state RFP. They don't know what they're gonna have for funding after that. So that's something we're gonna need to think about because they're already into their second year now. And we've gotten other funding requests that have come in. We've had a couple SSPs that have reached out, but sorry, I gotta backtrack. Back December 2023, when we voted on the SSP money, it was for all certified sites at that time. And when we did that, Health Equity Alliance was also part of that for 2 sites. When it got time for contracts, they were no longer part of that. So from that, there's been a couple programs that have reached out asking what happened with HEALS money. Is HEALS money still available? You allocated for that? I don't have the full answer on this, so apologies.
I'm sorry, Cassidy, I didn't know, what money?
Health Equity Alliance, when we did the
I'm sorry,
how many SSPs, yeah, they were part of the original vote. One of the programs that's in Bangor has asked what happened with that money, like, are we able to get it? Cause we picked up some of it. Another SSP who was a new SSP just reached out earlier this week in Rockland. They used to receive services from Heal. Heal would go down once a month and do certain service programming under their certification at their site. So now this site has got their own certification. They're building their own program. When new SSPs come on with the CDC and get certified, there's no money, not getting money. So they reached out months ago asking the same about HEALS money. Now they've reached out again. What happened with HEALS money? And separately, the CDC has asked, do you have money for other SSPs as they come on? Because we're getting asked. So as we build out this policy about non-grant cycles, like this is a big part of it. And as these requests come in, how do you all want to get that information? Like you all need to know these different things. There's been stuff that have come in for everything. There's an existing Dropbox that has been used like here and there before me. I never used it because I didn't know stuff was being uploaded outside the public hearing, so I don't know how much other people use it and look at it. I don't know if people just want emails, you want a Google folder that stuff's moved in and you can check on your own, like how do you want to receive information that you should know? I was a nosy council member, I wanted to know all the things, so how do we accomplish that? Maggie?
I feel like information on like grant related things, like the emergency requests or out of cycle requests, things like that. Part of triaging it, so we don't all jump in with 1,000 different thoughts, is sending it to grants only, like the grants committee. And people who aren't on the grants committee can be CC'd and aware of it, but it's the grants committee that needs to like talk about it and discuss it. And then, yeah, if there's problems with grants too, I feel like that's also where it lives. One thing though that I feel like we don't get that is really helpful, and maybe we do get it and I'm just catching, I feel like I catch it sometimes, but maybe it's just that they're not coming in as often, is the feedback from the public, the written feedback of this worked, this didn't, or other desires that they have. And that was really helpful the times that we did receive it as email attachments before the meetings. Or, you know, or if it's more time sensitive, maybe a blast, but it felt nice to get it kind of consolidated as like, here's the list of key things that people are saying right now and how they're feeling about the performance.
Yeah, and that's kind of also rolled in with what I was asking, like, how do you guys want to receive stuff? Yeah,
makes sense. They're not always distinct.
So I like that idea. My question for that would be that part of the thing is if we've got a request that doesn't really, if Program and Grants looks at it and says that doesn't really fit even the MOU, would the Grants Committee be able to share with Chastity, can you please reach out to that organization or whatever and say that what you're asking doesn't meet the MOU? Or do you want those decisions to be council decisions?
I don't even know if it needs to be. I don't even know if it needs to be the grants committee that says that, you know.
For Chastity, if Chastity gets a letter and it
He's
doesn't,
asking for something completely unrelated, then, you know, I feel like it's most respectful to just let them know that, right? Maybe if it's in a gray area and there's an,
yeah,
and,
Okay.
you know, even conservatively, maybe there's a world in which it relates, then it can go, but it makes sense to me that Chastity, you're empowered to say if it's wildly off.
so.
Can I just ask a procedural question, which we probably don't know the answer to, but it's the way my mind works, so. So it seems that Chastity just posed a bunch of different questions that we've, some of which we've heard before, right? So one of the issues I think before us is we have made some decisions as a council in the past around our budget. And that needs to be updated and that works ongoing and stuff and but there are a number of variables that are, to me, in my mind, are related here, right? So if we know what our budget is and we've allocated some of that money for someone else who's no longer able to use it, and we redistribute that money, that's one thing, right? That there needs to be a process for that, but that's, to me, it's a little bit different. If we've established a budget, some guidelines, and we have new requests comes in, whether it's from an SSP or whatever, we should be aware of that, either through grants or however we. But if that doesn't fit into our grant cycle, we can't keep adjusting our budget. We can, but we're gonna run out of money, right? And which is which at least tentatively, we originally said we wanna try to spread this out, so that's why we had that, the longer term plan. With some short term, one time or, you know, money in there. The other issue that's out there for me is just, it's procedural more than anything else. I've mentioned it at finance, is that, you know, cause you've asked another question that we moved on from, which was, what about January 2026? Is my funding gonna run out? My thought process was, these are 2-year grants. Reapply, there's no guarantee for 2-year funding. You know what I mean? In general terms, that's what I thought the rules were, the parameters that we had initially set. So now I'm not saying we should change those or that there shouldn't be, that they, you know what I mean, that things can't go along there, but it seems like, in my mind, some of these things just have to be a little bit. I need a clearer understanding as a council member of what some of these general parameters are, and so then we can have a discussion collectively or at a committee about what modifications, because we know it's gonna have to bend and change. That happens, but I don't think that makes sense, but it's a little blurry to me when we jump around. You know, prevention grants make sense. Probably to be a little bit longer than 2 years for some of them, right? But we've kind of set this 2-year parameter for the first round of grants and the other pillars. So it just gets blurry in my mind. You know, I don't know how we do that. I know finance is working on it some. I know grants is working on that aspect of it too, but. So it's hard for me as a council member to make a motion to answer your question on.
No, I know.
Because I just, it's not that I don't wanna keep kicking these cans, because these are real issues for these folks who need the money.
Right, there needs to be an absolute discussion on when we did these grants, is everybody gonna ask to reapply? Because there are some people who believed it wasn't what we were doing. We have never truly stated this was a 2-year grant. In 1 year or 2 years, you're gonna have to reapply again. That's never been decided.
I think we made it very clear this is a 2-year grant.
Well, that's what I thought, but I've had some other members say not.
No,
See, to me, it was 2 years.
We have contracts that are 2-year contracts, so if anyone believes differently, I'm sorry, but we have 2-year contracts. I do think that we do need to have this discussion in the program and grants committee of what should we do, like, and I think we're a little off cycle, right? So we have some folks who are on, it'll be 2027 when theirs is up, and we have some who will be up in 2026. And so what will be our process and how will we redo will it be a new RFP process? I do believe sometimes when Ben was talking about the budget, he was like, well, there'll be some things that will continue and some that will be one-time grants. So I do remember him saying that, and I think that that's probably true that there will be some who will reapply, and we're like, yeah, that should be continued, because it was not a project that that they can find other funding for. But I think saying to Joe, another thing we want on the program grants committee meeting is this starting to discuss what's the next cycle look like for, and being real.
And I think it needs to be done quickly, because again, these were 2-year grants. We're already we're heading to we're already doing year 1. We should be putting out grants before the money runs out for those agencies. We should be doing that quickly, about setting dates and reapplying, putting those up.
Well, that's in a year and 8 months for most
Yeah.
people, so I mean, we do have time, but I think it's these ones that did get it early on.
Yeah,
That we have to.
Yeah, like that
address.
original funding
Yeah,
package.
correct,
Yeah.
which was about $9 million. Yep. So that's a significant amount of money to put out for grant.
Well, except for many of those didn't actually make it into that.
Yes, mostly the SSPs did,
But even, yeah,
but the other ones really did.
most 2027 is the end date for most, for most, even those that were originally funded still have a 2027.
Yeah.
And if I could, I don't know if I was clear, but I think that the work that the treasurer and the finance committee is doing, it will be helpful. These discussions have to be in parallel, right? If we've made, or if the council would like to change the budget or the parameters I thought we've set kind of for the budget, whether it's cast into stone or not, nothing, that any of that could be changed, but it will be helpful, because then it would answer some of Chastity's questions. In other words, if we had 22 million earmarked for fiscal year 25 and we've spent 22 million, there's the answer to your question. There's not gonna be any SSP money until next year. I know it's not quite that black and white, but it seems to me like there just needs to be, it's gonna be tough for the treasurer to figure this out until we have some pretty clear parameters there.
It does.
For expectations.
But I think there's a great conversation about programming grants.
Just said, I was planning on speaking in the other business part of or asking to speak about the sort of new settlements that are coming online, which will bring in additional money. I can instead talk during this discussion about it, or I can talk later.
We were discussing more money.
Bring it on.
Bring on the more money.
More money, bring it on.
We're the only department here that's bringing on money.
As the Attorney General talked about at the Governor's Opioid Summit, Maine has moved forward with two new sort of groups of settlements. One is the settlement with Purdue and the Sacklers, and the other is a group of 8, I'll say sort of smaller opioid manufacturers where the dollar amounts are not substantial enough to warrant the kind of sign-on process for each one, so they were bundled together for sign-on administrative ease. What's on the screen right now and is relatively hard to read, can you go to the bottom of 2025? And then can you just make it bigger here, just essentially column C. So 2025, column C. Yeah. I don't know, that's a little better. Essentially, if you look at really column E, that's the Maine Recovery Council column. What you're seeing above the line that says 2026 is the settlement payments from the existing settlements that are coming in. And the amounts in column E as of last week have come in the door, as I understand it. So that should be a total of $6.648 million that has come in between March and last week. I can't say how that factors into the budget and how much is really available versus how much is being committed. But I'm just letting you know that that's sort of the current settlement structure. The new settlements, can you go to the AG's website? The new settlements, go back a page. That are coming online. There's information about them on the link at the bottom there, 2025 settlements FAQs. This page provides some information. And number 2 here tells you how much is potentially going to come into the state from these 2 new groups of settlements. Can you pull up that spreadsheet? And this spreadsheet, when you click on it, shows it's basically built the same way as the regular opioids spreadsheet. So if we were to scroll all the way to the right or left, depending on which direction you look, you'll see how much each subdivision would get. These numbers are estimated maximum payment amounts. Scroll down a little bit, so the total, so the total would be, another $30 million could come into Maine, 15 million and change to the Recovery Council over roughly, 10 years at the kind of outlier. That $30 million total is only going to be realized if, as we have with all of the other settlements, 100% of the 39 subdivisions that are eligible to sign on actually sign on. If any do not, then we don't get all of that $30 million. The settlement sign-on process is going on right now. The word has gone out for the Purdue settlements to the subdivisions. The sign-on process is about to go out for the sort of group of 8 manufacturers settlements. And so, I want to highlight this as to let the council know that it, will have some additional money coming in the door. This money probably won't land until 2026. I can't even begin to say a month, but I'm fairly certain it'll come in 2026 for the first year. The 15 million that would come to the council again is the maximum estimated, depending on lots of factors, the most important of which is which of the eligible subdivisions sign on to the settlement. If not all of them sign on, the state doesn't get that entire $15 million. So the process is ongoing right now. There's a settlement administrator that's getting the word out nationwide, including to Maine's subdivisions. And this will impact the Recovery Council's budget one way or the other. And I want to just make sure everyone knows about this so you can take whatever steps you want to take.
I don't understand that the litigating subdivisions, whether they sign on or not, has anything to do with how much money the Recovery Council gets.
So first of all, there's 2 groups of subdivisions that matter. It's litigating and the non-litigating subdivisions. And they, in order to get that $30 million number, which is what the Recovery Council's allocation is dependent on, because the Recovery Council gets 50% of whatever comes in the state. In order for that $30 million to come in, the defendants in all of the settlements require that sign-on comes from the state, represented by the Attorney General, and from the litigating subdivisions and from the non-litigating subdivisions. And so if any of them don't, there's formulas in the settlement that, essentially whack the state, certain percentages for failing to get all of that sign on. The reason for that is the defendants, they're willing to pay the money, but they want peace. They want to know that folks that could sue them aren't going to.
That was part of the agreement.
Right, so the subdivisions, if only half of them agree, then their amount would be 15% of the 30 million. So you take that right off of the 30 million and then reallocate it. Would those subdivisions that do sign on, would they get more since subdivisions get 30%?
You scroll over a little bit. So you look, so starting with the blue columns, that we don't need to see, we can show each subdivision, but we don't need to for what I'm about to say. The way it would work is if Androscoggin County chooses not to sign on, it would not get its $152,000 over 10 years. The total that would come into Maine under column F would also be reduced by, you know, the formulas in the settlements say, for example, if you get 95% sign on, you only get like 80% of the money. Because the percentages are built to say it's really, really important to get everybody. So it's not a 95, you get 95% of the money, it's 95, you get less than 95% of the money. So everybody in Maine, so if Androscoggin County doesn't sign on, it doesn't get its 152,000, but also Aroostook County would get less. And Auburn would get less, and Augusta would get less, and Bangor would get less. The recovery council would get less. So does that help? Yeah.
Is there any reason why a subdivision would opt out of the money?
I can't, it's hard for me to speak for the subdivisions about that. What I will say is so far we've had great success in cooperation from the subdivisions. Cooperation is the wrong word. Great success with getting everybody to decide that this is something that would benefit them. So far we have like 9 settlements already. We have 100% sign on. We have a great track record. I'm hopeful that, you know, subdivisions will continue. By subdivision, I mean cities, counties, and towns. They'll continue to see the value. The one thing I will point out though, that, you know, if you're a city, county, or town, trying to find the scroll bar here. Sorry, Grace. Some of these numbers get kind of small. Like here, we're looking at Calais gets 76,000 over 10 years. You know, it would get like one of the settlements would distribute $197. Like some of them, it would be, you know, you would understand that they would be like, we're not going to get that much. Why are we going through all this trouble? The defendants and the plaintiffs have been doing a lot of work to try to minimize the amount of administrative hassle by grouping the settlements to make it easier to just say, you know, you don't have to do this 8 times or 9 times or 10 times, you just do it the 1 or 2 times. So that's one reason, is that they themselves may not see the value, but if they don't sign on, their county will get less. And you know, they live in the same county, or their neighboring county, or their neighboring town or city. The other factor that is an issue, concern to me, and I'm not well placed to know whether this is a legitimate issue. The last time Maine went through this exercise was 2 years ago, when the last group of settlements came on. Since then, there's been an election, and many of the people, some of the people in each of these cities, counties, and town offices may have changed and may be unfamiliar with this process. So there could be some, like, I don't recognize that email, or why am I hassling with this, or, you know, things like that. So that is one potential barrier. We've tried to, can you go back to AG's page? That's part of why we tried to, you know, develop this FAQ page. It provides a little bit of information to subdivisions. You know, there's also information from the settlement administrator. There's information, there's like websites dedicated to these settlements. So a challenge is that, you know, in the Attorney General's office, we can't provide advice to, you know, litigated or non-litigated subdivisions about whether they ought to sign on. That's probably legal advice, and we can't get into that kind of thing. But we're, you know, we want to make sure everybody knows about it, knows what their opportunities are. I'm done.
Any other questions?
I can't.
I still have a couple separate things. It's gonna end up going back to Brendan in a minute, but, okay, so my answer is still, or my question is still unanswered on how you want to like access the information. When it comes into us, I'll still respond between Elizabeth and I, we'll still respond. But how do you wanna access it? Do you want it in your meeting materials, like?
I think it goes to program grants, I think is what I heard.
No, I think, sorry, are you asking like what kind of like, where do you want it
Yeah,
sent? Like it can go,
Cause like not
the
everything is gonna
Dropbox
need to
was
be
tricky
the-
because we weren't sure if it was being actively used or passively used, and so it wasn't like you would go to the Dropbox unless somebody told you, you need to go to the Dropbox now.
Maybe just an email that says, there's stuff in the Dropbox and it concerns X, Y, and Z. And then you see the email, and then if I wanna go to the Dropbox, I go to the Dropbox, and if I don't, I don't.
And it's got the embedded link in the email, so you don't even have to use attachments. If we wanna click on the link and read it, we can.
Okay.
Would that be reasonable for you? It's.
Whatever's gonna work for you guys, just something, cause like all these different things, even if you don't need to do anything with it in the moment, like you guys wanna know. And
Right.
guide your work, so you wanna know.
How about a quick email
And a link to the Dropbox.
and a link?
I'm not sending you the link every single time.
Realistically, it's fine.
If it's the link to the file, sorry, so that way you've got the organization system going in the background, but then somebody just has to click in the files there.
I don't know how to access Dropbox.
That's
You don't have
okay.
the link. I
That-
have no idea.
So do you all, how many of you use Google software? Like, do you use,
You mean
Okay.
Google Docs?
yeah, like,
Google-
is it more
Google Docs?
accessible for you if we give you a Google folder and that's where we organize information? As opposed to Dropbox you don't know how to use?
I don't know. I don't know how Google Docs works.
But you can show me.
It's more intuitive than Dropbox, so.
I agree.
Yeah.
That's where I was hoping to lead you. Very
Why just too diplomatic,
The Google, and if anyone can't, they can reach out to you and get quick instructions. And how about we limit that maybe once a month you update us that there's some new information in there?
Yeah,
rather
if
than
there's something
every-
that's like time sensitive,
Yeah.
we'll tell you.
If you're getting a request every other day, we don't want it, so if you can figure out something that looks logical to you.
Once a week.
Yeah.
Like every Wednesday, I get an email from you that says, here's what's there.
But look at the.
Or,
I like keeping it flexible right now, just use your judgment.
I don't care, but.
I actually love it when I get MRC emails, I'd love more of them, sorry guys.
Because they're.
They're fascinating and it's.
So does that make sense? So you will
Yes.
determine on a regular basis, but I don't want you to have to every time you get a request now, email 15 people. So,
Alright, RFP. That, the executive committee is gonna be reviewing it, scoring. That meeting's the end of the month, 29th.
29th.
And we need some guidance here for decision making. It was 28,
Yes.
28.
That's, it was pointed out to me that that was the Friday before Labor Day, okay?
Fair point.
The last council meeting, it was decided that executive committee was gonna review those.
Thursday, yes.
Cause it was a mix of grants and finance people. Is the executive committee just making the recommendation back to the council
Yes.
or the,
No, it's just a recommendation back to me.
okay,
What time is it?
so
1:30.
Well,
the RFP said that the applicant was chosen, that they would be told September 1st. Next council meeting is September 11th, so we will just have to reach out to them and let them know.
There's only two.
Or the council could choose to vote and give the executive the decision-making authority for this. That's your guys'
So,
choice.
so here's the issue, I can tell you, that we cannot go into executive session to make this decision.
No.
So if either one of these applicants are listening in, they'll be notified.
Well, and we also can reach out to them
Correct,
and let them know.
you can reach out to them and
It's gonna
say
be
that the full vote,
discussed publicly.
yeah, that the full vote, yeah. But it will be, it will be a public meeting.
Sorry to make it complicated. And you can tell me not worth going down that rabbit hole, but why is that allowed to be protected?
It's not, we have to be published.
Okay, but the deliberations are gonna be, I mean, we will have a type of deliberation, but it will be after.
Personnel.
The executive.
No, it's
No,
not,
no.
executive committee, not an executive session.
So it's still a public
It's
executive.
still
Yeah.
public, yeah.
It's still public, it's just the officers and the two at large. They will review the two, then they will determine which of the two that they wanna bring as a recommendation to here. Yeah.
So the executive committee has gotten all of those materials, they've gotten the scoring metrics. You'll wanna do that before the meeting instead of trying to do it all in the meeting. The materials, it's a lot, the applications are a lot, you're not gonna want. We'll re-forward it. I can forward it, but
I would re-forward it, and as the chair, if we're meeting on the 28th, I'm gonna ask by the 22nd that your scoring sheets are in. And then you can to the. No, never mind. You don't need them in advance, do you?
I was gonna have them done in advance, so we don't have to.
Yeah, that's what I'm saying. So they have to have their scoring sheets to you.
Yeah, that was the hope, if that's possible.
Yeah,
That works.
so we can review the two, score them, and then send them to Elizabeth by the 22nd of August. Is that,
Have we gotten that information yet? I don't recall getting it.
I believe so, but I will resend that today. Yes.
so if you can review the two, score them and send them to you by the 22nd, does that give you enough time before the meeting on the 28th to call it?
That would give me more than enough time, yeah.
Okay,
Just for clarification, our individual executive committee members scoring and sending results to us.
Did you get the material?
I have 50 unread emails in my inbox. I was just on vacation, so there's a chance.
I think it was during vacation.
Okay.
I just sit on my porch and read.
I would too if I had something to read. No offense,
By the end of
but
the day tomorrow, they will be
I have not scored them.
By the entire committee.
But so we get them,
Doing a great
the
job.
goal is that you have
sorry.
till not this Friday, but next Friday, to read and score them, send them to Elizabeth. She will calculate them, do whatever she needs to, so we'll have all that information on that meeting that Thursday. That work for you?
Yeah.
My
that's-
apologies,
we're putting it together.
I sent them and
No, you're totally good.
I
will resend that to everybody.
I didn't,
I see, you don't let everything on.
okay.
Something easy. So in trying to think about how to make things more accessible, you know how if you're just trying to watch the public meeting, you have to go to the website, download the agenda, get the Zoom link and join, and it's different every time. Grayson's gonna try something new out for us instead, so if it works going forward, it will be easier. Instead of that public Zoom, we will be like city councils where it's just YouTube live stream and the public can still access it. Our channel's right there, so it's easier to find. You don't have to go through all the other steps. And as far as like public engagement, public testimony, we'll just have to send like the webinar link to the people that sign up. So I don't think it's gonna cut anything off for anyone. I think we'll actually hopefully be more accessible to people. So next month we'll try it.
Will it be easy for the non-tech people?
Yes.
Okay,
Easier.
Yeah, it will be easier.
Jesse, you're looking at me.
I looked at that.
he's looking at me.
But yeah, it will be easier, and like people that have the YouTube app or use it on their web browser, you can follow our channel. So you can be notified when we go live, so like all of our committees, all of our meetings, all in the same place. And we don't have to do the back end, Grayson doesn't have to do the back end side to upload the meetings after, so it's all there,
As long as it's easy, okay.
hopefully. We're gonna try. Brendan, I'm gonna hunt it back to you a little bit. So we have one of our contracts that we struggled with. And I'm gonna let Brendan kind of explain some of the challenges with that, and this, I don't know how much we actually need from you all, but in keeping you.
So, I don't have a copy of the, proposal, could be distributed. I don't have a copy of that right now. This is, I don't know, do you want to introduce like who this is with and what it's for and all that?
So York County project, when we went through the grant application stuff, we reduced their award from what they applied to, so I don't remember what they asked for, but we reduced it to 300,000. And they submitted an updated budget, like in the timeline where Mary was already out and I wasn't there, so like terrible transition time for everything, so we've been very delayed, it's like.
Yeah, we're in our sort of contracting blackout.
Yeah.
phase.
And nothing could go out then, so they're not set to get their money until fall.
And they're not alone in that.
No, it's on our thing here, there's a bunch of people that aren't getting money until the fall. Because of the different timelines we had to work on. When that came, there were a few things that raise concern is not the right word, but that were highlighted because it's tricky in writing the contract and how they were spending the money. All of the funds were gonna be spent on kitchen supplies, and the council hasn't written any contracts or stuff that wasn't like rated in different ways, so it covered like staffing or like other allowable uses. So these have been some of the challenges that come up, and I'm gonna let Brendan take that part from here.
Yeah, so as the council knows, like the opioid settlement funds are required to be used on the approved uses that are described in the MOU or listed in the MOU. The point of the money generally is that it's meant to be used on opioid abatement programs and services that are evidence-based or evidence-informed in general. Your county's proposal came in through the normal course of the council's application process. It was reviewed in the normal course, the way they all were reviewed. And I don't remember which sort of tier it was voted in, but I think it was swept in as part of that last group of projects that were sort of
Second meeting, yeah.
collectively like, hey, let's all agree to all of these things. Except for as part of that, they originally asked for $1 million, I think. And part of the whole gist of what they were asking for their money for was to fund York County's development of its new facility in York County to provide treatment, recovery, not treatment, but detox, recovery support, and maybe treatment and maybe sort of other opioid abatement related activities. I think a piece of it's meant to be pre-corrections diversion, maybe not, maybe it's meant to be open to the public. I don't have a complete grasp of what the project is, but it's available to review. The original $1 million ask was they were putting together money from a number of sources, including their own settlement funds, including congressional appropriations, to basically build this facility for these purposes. As part of that $1 million ask, it was, some of the, capital costs, part of which was kitchen supplies. When the council reduced its, the council said, yeah, we will give you money, effectively, the council said, we'll give you money, but we won't give you $1 million, we're willing to give you $300,000, and you have to come back with a revised budget. And the revised budget that they came back with was essentially kind of a shopping list is a pejorative way to put it, of basically how outfitting the kitchen of this facility. So the long and short of it is, the council's, the council has to restrict the use of its funds for opioid abatement. That's evidence-based, evidence-supported. There are parts of the approved uses that talk about treatment, that talk about detox, that talk about, pre-arrest diversion, and the kinds of things that are going to be happening or envisioned to be happening in this facility. The council's money won't be directly doing any of those things. And when you read the approved uses, they talk generally about, providing services, providing comprehensive wraparound services, providing the full continuum of care of treatment and recovery services, whether it be providing counseling, peer support, and so on. This is like attenuated from those things that are described in the approved uses. The argument has been made and can be made that by having a kitchen there, where the council is enabling those things to happen. They're feeding the people who are in residence there, who are, staffing the place, who are providing medical services, possibly family members. I'm kind of extrapolating, I don't know that. It's not clear if it'll be open to the public or the kitchen that is. It's not like, I don't know sort of the parameters of what the kitchen will be kind of used for. But the council's money won't be going to abatement. It'll be going to help somebody else provide abatement. And, in reviewing the contract or the request, I'm prepared to go forward with, I'm prepared to say the council can go forward with this contract. But there is going to be, just to some extent, this could create, some precedent, either in your own minds or in the community, about how attenuated the council's funds can be to opioid abatement. And what is the impact the council's money is having on the opioid crisis in Maine? If we think about under the contract, there will be performance and financial reporting. What is the performance reporting of kitchen supplies? How many meals served? How long did the kitchen supplies last for before it broke or had to be replaced? Is it more appropriate to look at, what the facility as a whole is doing, even if the council is not actually involved in that work? So this presents, as part of the context, before Mary left, there was a phone call with me, Mary, I think Chastity, if I recall, and folks in your county to say, what you're asking for the money to be used for is pretty attenuated from opioid abatement. Is there anything else you could use the money for that is more directly tied to opioid abatement? And the way the conversation went was effectively, no. We applied for this money, we told you what it was for. The council scored it, reviewed it, scored it, and told us that, we could have this money. So the point of that conversation was to make sure that to a large degree, that was driven by me, because I wanted to make sure that the council's distribution of its money is as closely tied to abatement as possible, so that there isn't any question that the council's money is being used for things that aren't opioid abatement activities. So I think, you know, part of the reason that we're bringing this up is to let you know that this is happening, to let you sort of have an opportunity to weigh in on the issue of attenuation. You know, what if it was for paving the parking lot? What if it was for air conditioning? You know, those are probably more case by case discussions. And to seek, I think, whatever additional feedback you might want to give us, and maybe Chelsea has specific feedback. But I'm preparing to, like, you know, I've looked at it, I've talked to others, I think I'm prepared to say the council, you know, can go forward with this contract. You know, I'm doing some additional work to think about whether there are, you know, contract terms that ought to be put in place to ensure that the money is, you know, used for its intended purpose, and that it, you know, it's used for a certain period of time, and to do my best to guarantee that the council's money gets used, you know, for these purposes. But this, you know, your county is rightly saying, where's the money? Even if we didn't have these questions, we're in this contracting blackout phase that's about to end. So the money's going to be able to go out soon. But, you know, this contract is raising, you know, sort of policy questions for consideration. So did I talk about
Yeah.
things you thought I ought to talk about?
Yeah, I mean, Tess, go ahead.
I want to speak for myself from someone that's been to detox and residential treatment. Having a kitchen is necessary for treatment, is it a core activity to provide? So I think in terms of measuring outcomes, it's involving the participants of that rehab. I would view it as, is this group of products, capital expenses directly tied? And I would even make the argument, if it wasn't available, could this activity continue? So I would be, and this is just me personally, I would be in favor of moving forward with the contract.
And I sort of agree with Tess. I mean, if you go into any peer recovery center, the amount of support and care that people get sitting around a table with a cup of coffee and a meal is an important part of early recovery. That, I mean, I don't know what the 30,000, I'm assuming they're not buying spatulas with it, but it must be equipment. I know that if you go to a peer recovery center or go to a treatment center, I know that when I ran 2 halfway houses, the most treatment that went on wasn't in the group room. It was sitting around the kitchen table, preparing a meal together and sitting at dinner and talking to each other and supporting each other. So technically, it's not, in the words of an evidence-based program, that a sandwich and a glass of milk makes you feel better. But the key is that I think if your county presented it to us, this is what we believe, I think it's a valid use of funding. It's part of who you are. It's really hard to recover if you're hungry. And it's also a teaching tool. I know that, you know, they have cooking lessons. I don't know what they do here, but in various places, they bring that in. I'm in favor if that's what they're doing with the money. I don't have a problem with it.
I don't, when I characterize it as a kitchen, I don't know whether it's a commercial kitchen or like a commission for the kitchen for the, you know, people who are there and working there to use personally. So it's 300,000 for kitchen supplies, and that's kind of all that's the limit of what I know about.
I really like Tess's idea of how to judge it. Could this occur without that? And it could not. And I think we could I think that's a really great way to use it for each case where it's kind of attenuated from the, you know, the words of that MOU.
And if the provider is seeking, say, main care reimbursement, food has to be a component of that. I mean, I don't think you could enter treatment if they're not providing food.
And Maine Care will not cover anything to do with food, with room and board. So if you were in a halfway house and you were getting reimbursed, it cannot be reimbursed to reimburse your food, the food or the room and board. So you're by doing this, you would be doing them a favor because Maine Care won't cover the cost of room and board.
And in describing what their plan is for this facility, you know, I've only described sort of my kind of anecdotal understanding. I think they present it to the council, so you may all know,
They didn't present the first term of the council, they sent a proposal to us about like their whole project. Very early
But
on.
Maine Care will not pay for anything to do with food.
I just need to say the way I've characterized it may not be accurate. That's just sort of my rough understanding of it.
And I can tell you the commercial hood that has to go over that stove is probably $10,000 to $15,000.
I want to cook in that kitchen. Sounds like a great kitchen.
May I just ask a question about, I mean, I think it's like, okay, I feel like I am hearing different things. I'm sorry, I had to leave for a work call. So they wanna use $300,000 for kitchen supplies for their treatment and detox center. And the question is, I mean, cause we've paid for buildings for capacity building things. So we paid for the building for the recovery center to go into. I mean, I guess for me, it's like, is this an essential element of the treatment and detox center? And if it is, and it's a part of capacity building, then to me, it goes into the bucket of capacity building to actually be able to provide a service. And so then the service is provided over a certain number of years. I mean, because we paid for other people's buildings, and if a kitchen is an essential part of the building, then it's part of the building.
Yeah, the council paid for milestones renovation, or I don't know, renovation might not be the right word, but
Yeah.
like reconfiguration.
Yes. And so I guess like, is it that, or is that what the money is for this essential components? Or is it non-essential components that are, you know, sort of add-ons that would feel good, but aren't essential components? Because I do think that's where we may move ourselves a little further away from what is the MOU, which is like paying for abatement. And so if they can provide the services without this, I don't know what it is. I'm just saying, to me, it feels like we should find that out and know, is this an essential part of providing the services? And if so, of course we should pay for that. That's a part of what they need for the capacity to deliver the service. You know, and cups and plates might be a part of that, like you need cups and plates to do that. So, but I guess if that's where you're coming from and wanting us to know exactly what we're paying for, which I think is great, we should know what we're paying for. I don't know, I didn't read that proposal, so like, I don't know what the budget says or what they said. But I guess I'm okay with finding out. And I'm not, this isn't to say that I don't agree with you all, I do, and yet I also am like, yeah, I mean, this is a multi-million-dollar project that they have going on.
And I want to be candid that I'm probably the least useful person in this group to evaluate whether it's necessary or.
Well, I think you could ask them, I guess that's.
I mean, wouldn't any grantee say, of course it is?
We did, and they did.
Yeah,
And they said yes.
I mean, they would.
Well, then I'm inclined to, if they said yes, it's an essential part of like providing a service.
One of the things we talked about, just to be thorough, both with you and on the call with them, is the concept of like, so you need money to pay for pots and pans. We'd love to give you money for abatement, or for direct provision of services. Could you, even though this is fairly artificial, switch the money, you know? And they said no. And part of the reason they said no is because they've established a kind of foundation to raise money for it. And they're, you know, as many as often happens with fundraising, they're quote unquote kind of selling the rooms or, the actual, places where the work is happening, for naming rights and things like that. So that is out of the question. I raise it only because I recognize that there's sort of semantics or artificiality between like this plot versus that plot, and all the money gets mashed together and funds the project as a whole. So just to be thorough, we did raise that possibility and also got a no.
Sorry, I was out of the room also from much of the discussion. Are you asking for direction, the council? Are you looking for a vote?
Mostly, I wanted everyone to know, because in full transparency, this all came up like as I started, the issue was already raised with them. I knew nothing of what was going on, so there's a lot of confusion. First meeting with them, they're not happy, like they don't want to engage in any back and forth because the process has been so long. And I had like the same confusion and thought that you all are having on what the issue was and couldn't wrap my brain around it. So in general, I wanted everyone to be aware as this goes forward.
And to the extent that, the performance measures, or I guess the financial measures will be, yes, we bought the things. But the performance, like what does the council want to know about this particular contract?
That's the advantage of the vendor relationship that we're like hopefully gonna start soon, is they're gonna help us think through some of the indicators, but it's not we just have clear definitions what are direct and indirect impacts of our programming. I think the performance indicator on this is the amount of people that they serve.
Yeah.
And
The facility or
the facility, and then we count it as an indirect indicator, and we just make that really clear, this is not direct impact. So I think we can navigate that, and I'm excited to see it come to fruition. I understand why they're frustrated. I also appreciate the diligence in making sure we're staying true to our mission.
That's it for me.
Right, so you're comfortable with the fact that we're gonna move sort of all, since we're gonna move forward with the way the budget was that we approved? And then again, include the performance indicators of the. Okay.
With facilities, I forget the word we used earlier, for money that's used to pay for, facilities and stuff.
Capital expenses.
What was it?
Capital
Expenses, yeah. I don't know whether the state has standard terms that it uses for capital expenditures. But in general, I kind of wonder whether, I think we did maybe with RWI or maybe with some others, whether maybe you have guidance on this. Any requirements that ought to be in place for capital expenditure spending, like it has to exist for X period of time, or it has to, this contract will be what, how long? 2 years?
2 years.
But they're gonna spend the money instant. I mean, so like during the term of the contract, it has to be providing, so the contract, in other words, is not go buy kitchen equipment, it's really go provide services. And to the extent you're not providing services, then don't we want the money back? To the extent that the facility gets repurposed for something else, don't we want the money back? Something like that.
I feel like this was an issue I brought up with like all the capital expenditure stuff of like, I think in contracts, it has to say how long they have to do the work. And I'm particularly concerned about organizations that are not government or nonprofits, but are for profit, that there be a clause of how long they have to do that and if they don't, they have to reimburse us. Because they're no longer providing services of abatement.
Right.
So I don't know what it is, but I think that's a worry I have had and have that we decide that. What is the terms? 5 years, 10 years, is it? we never made that determination.
And I think before the next round of grants, we need to do that, because it needs to be.
But it has to be in this you're writing into the contract now.
Correct. Fun.
I apologize if this has probably already been discussed, but I think also for future contracts, this is a contract that we've vetted, it's been approved. My opinion needs to be paid. I think we've talked about why. But if we're gonna have a process where mid-contract before it's signed and before the check goes out, that we need to reevaluate different steps or concerns that arise, we ought to understand what that process is. Yeah, for everybody, not just this particular, it's valid points. I'm glad that they were brought, because we certainly don't want to violate what our directive is, so just a thought. I've never done this before. This is new to me, so there's a lot of people around the table that have a lot more experience than I do, but it seems like much like we're gonna have a policy for between grant funding, we should have some sort of policy or at least guidance for Chastity and others around what to do if there's a red flag and how to slow down the process and ask more questions, and does that give us the right to modify the award that we've already? It probably does, but I just.
In fairness to York, we told them they couldn't have their full amount.
I understand.
And they had to send in a revised budget. So we should have had that revised budget looked at probably by finance to just make sure that it was, within the guidelines and gone from there. Again, I do believe, Todd, that we need those procedures. They can somewhat be avoided if we're able to do things in a more timely manner, but we get stuck in this process that we have that it takes forever to get that money out, that things change in between. If it takes us 6 months to award the grant money, or in some cases over a year, things change on both our end and their end, and that makes it more difficult.
I think with applications, I think this is true that the form says like pending successful contracting. And, I think to the earlier point, the council and I presume the staff want these contracts to be successful. So to the extent that things have changed, like, yes, we want to get the money out right away. Second, in the interim, if it hasn't, we want to make sure that the contract is successful, that we understand it, that they understand it, that we're all on the same page, that here's what the money is going to be used for. And if it's not used for that, we should have a discussion. Those are all things that come into play during the contracting process. A lot of that doesn't happen outside. A lot of that happens like behind the scenes. And some of those are policy driven.
So I'm gonna, Maggie, quickly, because we only have about 15 minutes for poor Elizabeth.
I was just gonna suggest quick one.
Yeah.
To close out timeline, I would just suggest Chastity suggests, based off of best judgment, the specifics of the contract, a timeline, and then we build in caveat language. As long as it's within their control, because, in many cases, changes in use are gonna be beyond their control. We don't wanna punish them for that also. So I don't think we can debate it all here, so.
Thank you, Elizabeth, I truly apologize, but go for it.
All right, really quick administrative thing, just because we had a couple of scheduling changes. I know, I think maybe it was the beginning of this month, end of last month, I sent out all the schedule holds, and so going forward, that's how we will update if there's any meeting changes. I know Grayson tries to cancel meetings, but if they're already on all of your calendars, we can't delete things from your calendar. So if there's, again, any change to a meeting occurrence or anything, that will be how we'll email, but that will also be how that will be found on your calendars. Is through that. And so the other things, I just have a couple of contract and then reporting. So we have 16 contracts left for a September 12th start date. And a good number of those are in progress. We have 3 that are actually finalized, ready for signature. We were just advised not to have those signed because we don't want the signature to expire before it can be processed by the finance department. But the providers are aware of that and are being very patient and are gonna be ready once those can be sent to them. And then seven of them, or six of them are in some stage of review, so whether that means the provider has it and has not submitted their edits, or they have and we just haven't incorporated them and sent them back for them. And then we have about 7 that we're still in the progress of drafting, and that includes about 3 that we're gonna work with Liz and why am I blanking on her name? Melissa, thank you, sorry, Melissa, for the prevention contracts, just to get a little bit of clarity and help on the health resource and action contract, the EZ contract, and the 2 general programming contract. But otherwise, I think we're in a pretty good place. I think 16 sounds like a lot, but I think we'll be able to get that done, hopefully pretty quickly, knowing that most of those are in progress. For reporting, we just finished sending out the reporting templates to all of the providers whose contracts are already in place, so that's like 50 something of them, I believe. And so I just want to reiterate Joe's point. So when we're sending those out, I think it became really clear that Chaz and I do not have the capacity to analyze all that data when it comes back. Even sending those out was a lot. And we've already gotten some good feedback from providers. We took your advice about keeping it pretty broad for the first one. So we asked them to, we listed all of the approved uses, and then we came up with activities that align with those. And then they're gonna select from those what they are capable or could collect data on. And a couple people have already pointed out either things that we asked them to report in that they can't or that they're not comfortable on. So things like for one of our treatment contracts, we had asked them, or not treatment, one of them, we asked them to report on the number of people diagnosed with OUD served. And they just explained that that's not something that they ask, and that they're not comfortable including that as something that they would ask people who come into their center. And so feedback like that is really helpful for us to have, knowing that as we talked about a couple of meetings ago, we're hoping to pare this back as we go forward. Other things were like we listed naloxone training in like 4 different ways. And so people pointed out that it can kind of be incorporated in one measure. So hopefully, again, we can maybe get some support to make that analysis and reviewing much more meaningful, because with all of those contracts, I know we don't want to have them do individualized reporting, but bringing that all together, I think, is going to be really complicated once we start actually looking at how they do that. And so their first reporting will be due at the end of September. So their first quarter is going to be slightly slightly longer than an actual quarter, just so everybody gets done at the end of September, and then they will start again beginning of October and then be done, so that we're not constantly having reports due based on different schedules. And then the last reporting thing, as Tracy mentioned, RWI is just finishing out their first year. So they put together a very quick report, so it's not an official annual report, but this is just a number or some of their activities from their first year. So they had about 1,000 or at least 1,000 unique individuals served during their first year. And so their contract started July 1st, 2024. So their grand opening was October 5th. And so just how quickly. Yeah.
For people who weren't on the council, RWI is the Piscataquis County Recovery Center, and we gave them money to buy their building and start the recovery center. First contract.
The church in Sangerville.
So just how quickly they were able to get that up and running from contract start date to October. And so they listed out all of the different community events and types of things that they did. And so it's quite a variety. They have met with individuals in the jail. They've been meeting with high school students and other with healthcare workers. They were meeting with other recovery centers. So it's quite a variety of events that they've been doing kind of locally and within the wider northern Maine, their reach. So, but it's good to see this so far.
Can we access that? Is that on the website? Is that?
We'll send it to
I
you.
can send it to you.
Thank
Yeah, I just want to reiterate.
They just sent it this
No,
morning.
that's good, perfect.
Yeah, and I just want to reiterate that this is like not an official,
I understand.
yes, this is outside of what they normally would do, but Georgia was very nice and submitted this for us, so, but I will include that. I think.
It's a very conservative community. It can be at times a little judgmental. And they really have embraced the recovery center. And you see them all over town. They're in parades, they're in road races. It's just really refreshing to see recovery just right out there. Again, in sometimes locally, it's really hard. It's a small area. And they're just doing really.
Channel 5 did quite a expose on them, what, 3 weeks ago?
My favorite thing is on anniversaries, on sober anniversaries, they ring the church bell. So when you celebrate, you go in and you ring the bell, and many times, how many years that you were, and it's great.
They've invited you all to stop by anytime you're in the area. A lot of people are in that area.
Like scraps, Wednesday scrap day. Is that it?
Yeah.
Is that it?
That's
You
it,
then.
the four of us.
All right, do we have any new business to come before the council? I don't think so. I think everyone's tired. The rain has stopped. Maybe it's cooled off a little bit. I thank you all who are listening in. Thank you very much. I thank all of you council members for being here, giving your input, and stay cool. And I'm sure, see you on a Zoom and then back here next month. Thank you very much. So adjourned.